is Mary Gurish.
Hi, I'm Dorothy Mammen from Middlebury, and last time I was here, I think it was probably 16 years ago for the civil union debates. I see many of the same faces, but so this reminds me of that, but I appreciate your coming to listen to Vermonters' stories, and I know this process works. I'm going to just talk briefly about two perspectives. One is that I worked for 10 years as an IT support manager at a large corporation in Vermont, providing customer support for users of our healthcare billing software. I made a good living doing that, and the insanity of our insurance company, though, it was apparent to me every day. Billing codes, diagnosis codes, modifiers, primary insurance, secondary insurance, inpatient, outpatient, different requirements for every insurance company, of which there were hundreds. Often the requirements completely opposite. One required some modifier, the other one prohibited that modifier. It's insane. We were a multi-million-dollar profitable department for the company, but none of this money was actually spent on healthcare. This was all billing. We can't get a leg up on the ever-increasing healthcare costs until we can address the, 30% of healthcare costs that's wasted on the administration of insurance billing. So that's one piece. The other piece is I retired early 4 years ago. Since then, I've utilized only preventive care until last spring. Then I had a small health issue. To me, it was fever and chills that turned out to be an easily treated tick-borne illness. Still, one doctor's visit plus the labs added up to $650. That was with insurance. So I'm lucky that I could pay that, but I'm well aware of many who would find that prohibitive. And so I feel that and it was enough to inspire me to skip the follow-up labs. I felt fine, so I skipped them. For that kind of deductible cost, and even co-pays are unaffordable to many people. A tick-borne illness can happen to anyone who takes a simple walk in the Vermont woods, and to me, the treatment of that, being able to afford health care for something like that is a public good. Left untreated, this will cause loss of work time, more serious illness, organ impact, financial hardship, and a downward spiral. It's to all of our benefit that we all have access to good health care, and I think it's most cost-effective if we take the insurance billing out of it and go with single payer. So I hope Vermont will make a start with universal primary care at least. Thank you.